Hey everyone, welcome back to the channel. Today we're talking about something that affects over 500 million people worldwide, which is diabetes mellitus. Now, if you've heard this word before but aren't exactly sure what it means, don't worry, you're not alone. In this video, I'm going to break down everything you need to know about diabetes, from what it is to how it's diagnosed, treated, and even how to prevent it. So grab your favorite drink, get comfortable, and let's dive right in. So what is diabetes mellitus? Let me start by explaining diabetes in a simple way. Insulin, a hormone released from the pancreas, which is an organ behind the stomach that also produces digestive enzymes. It controls the amount of glucose in the blood, and glucose in the bloodstream stimulates the pancreas to produce insulin. Then insulin helps glucose to move from the blood into the cells. Once inside the cells, glucose is converted to energy, which is used immediately, or the glucose is stored as fat or the starch glycogen until it is needed. So, consequently, if there is a problem with insulin, the glucose will remain in the blood and does not enter the cells, leading to high glucose levels. The levels of glucose in the blood vary normally throughout the day. They rise after a meal and return to pre-meal levels within about 2 hours after eating. Once the levels of glucose in the blood return to pre-meal levels, insulin production decreases. The variation in blood glucose levels is usually within a narrow range, about 70 to 110 milligrams per deciliter in healthy people. If people eat a large amount of carbohydrates, the levels may increase more. People older than 65 years tend to have slightly higher levels, especially after eating. If the body does not produce enough insulin to move the glucose into the cells, or if the cells stop responding normally to insulin, which called insulin resistance, the resulting high levels of glucose in the blood and the inadequate amount of glucose in the cells together produce the symptoms and complications of diabetes. Think of your body like a car. The fuel it runs on is called glucose, which is a type of sugar. Now, to get that fuel into your body's engine, which is the cells, you need a special key. That key is called insulin. Insulin is a hormone made by an organ called the pancreas. When everything works normally, insulin unlocks the doors of your cells and lets the glucose in, where it's used for energy. But in diabetes, something goes wrong. Either the body doesn't make enough insulin, or the cells stop listening to insulin, or both. And when that happens, the glucose stays stuck in the blood, causing high blood sugar levels. And over time, this can cause serious damage to your body. So now that you understand the basics, let's look at the signs and symptoms. Here are some common signs of diabetes. Number 1, frequent urination, because your kidneys try to remove the extra sugar through urine. Number 2, excessive thirst, because you're losing more fluids, you feel thirsty all the time. Number 3, increased hunger. Even after eating, your body isn't using the food properly because glucose does not enter the cells due to lack of insulin, or the cells itself does not respond to it. Number 4, unexplained weight loss. Your body starts burning fat and muscle for energy because they cannot use glucose. Number 5, fatigue. Without proper fuel, your cells are tired. And this is what actually happens. When the blood glucose level rises, glucose spills into the urine. When the level of glucose in the urine rises even higher, the kidneys excrete additional water to dilute the large amount of glucose. Because the kidneys produce excessive urine, people with diabetes urinate large volumes frequently, causing polyuria. The excessive urination creates abnormal thirst, so comes polydipsia. And because excessive calories are lost in the urine, people may lose weight. To compensate, people often feel excessively hungry. Symptom number 6, blurred vision. High sugar levels affect your eyes' lenses. Symptom number 7, slow healing wounds. Sugar slows healing and weakens your immune system. Symptom number 8, numbness or tingling in hands, feet. Nerve damage can happen early. And here's the tricky part. Some people have no symptoms at all, especially in the early stages. That's why regular checkups are so important, especially if you're at risk. Let's talk about types of diabetes. There are three main types of diabetes: type 1, type 2, and gestational diabetes. Let's start with type 1 diabetes. In type 1 diabetes, formerly called insulin-dependent diabetes or juvenile-onset diabetes, it is called insulin-dependent diabetes because its treatment requires insulin from the start, and juvenile-onset diabetes because it affects people earlier in life. In this type, the body's immune system attacks the insulin-producing cells of the pancreas, and more than 90% of them are permanently destroyed. The pancreas, therefore, produces little or no insulin. Fewer than 10% of all people with diabetes have type 1 disease. Most people who have type 1 diabetes develop the disease before age 30, although it can develop later in life. Scientists believe that an environmental factor, possibly a viral infection or a nutritional factor during childhood or early adulthood, causes the immune system to destroy the insulin-producing cells of the pancreas. A genetic predisposition makes some people more susceptible to an environmental factor. When an adult's immune system attacks the cells of the pancreas, diabetes develops more slowly than when a child's immune system attacks. This form of diabetes, called latent autoimmune diabetes of adulthood, is rare but may initially be mistaken for type 2 diabetes because it afflicts patients later in life. Now we are going to talk about type 2 diabetes. It's the most common type, accounts for around 90% of cases. In type 2 diabetes, formerly called non-insulin dependent diabetes or adult-onset diabetes, it's called non-insulin dependent because its treatment begins and may continue with oral drugs. It's not dependent on insulin as type 1, but if the drugs cannot control diabetes, we will start insulin. It's also called adult-onset diabetes because it affects patients later in life. In this type, the pancreas often continues to produce insulin, sometimes even at higher than normal levels, especially early in the disease. However, the body develops resistance to the effects of insulin. As type 2 diabetes progresses, the insulin-producing ability of the pancreas decreases. Type 2 diabetes was once rare in children and adolescents, but has become more common. It usually begins in people older than 30 years and becomes progressively more common with age. About 30% of people older than 65 have type 2 diabetes. Now, what about the third type, which is gestational diabetes? It happens during pregnancy, where the hormones from the placenta block insulin action. Gestational diabetes usually goes away after birth but increases your risk of developing type 2 diabetes later. After knowing the types, you might think what actually causes diabetes. When too much glucose circulates in your bloodstream, it causes diabetes, regardless of the type. However, the reason why your blood glucose levels are high differs depending on the type of diabetes. Insulin resistance is a main cause of type 2 diabetes. It happens when cells in your muscles, fat, and liver don't respond as they should to insulin. Factors include obesity, lack of physical activity, and high carbohydrate diets. Type 1 diabetes happens when your immune system attacks the insulin-producing cells in your pancreas. This autoimmune response leads to insufficient insulin production. During pregnancy, the placenta releases hormones that cause insulin resistance. Conditions like acromegaly and Cushing syndrome can also cause type 2 diabetes by disrupting hormonal balance. Physical damage to your pancreas from a condition, surgery, or injury can impact its ability to make insulin, resulting in type 3C diabetes. Long-term use of certain medications, including HIV/AIDS medications and corticosteroids, can also lead to type 2 diabetes by affecting insulin sensitivity and glucose levels. So now you know the types. Next up, who's most at risk? Certain things make you more likely to develop diabetes. Here are the top risk factors. 1. Family history. If someone in your family has diabetes, your chances go up. 2. Overweight or obese. Extra weight makes your body less sensitive to insulin. This is because the fat accumulated in the waist regions release fatty acids that affect the receptors on the cells that respond to insulin, make them less efficient. 3. Lack of physical activity. Exercise helps control blood sugar. It enhances the cellular response to insulin. 4. Poor diet. Eating processed foods, sugary drinks, and too many carbs. 5. Age. Risk increases after age 45. 6. Ethnicity. Higher risk in African American, Hispanic, Asian, and Native American populations. 7. History of gestational diabetes. Increases your chance of getting type 2 diabetes later. If any of these apply to you, talk to your doctor. Early detection is key. So, when actually should I see a doctor? You should see a doctor if you notice any of those symptoms we talked about earlier, especially unexplained weight loss, frequent urination, fatigue, or blurred vision. Even if you feel fine, regular health checkups are important, especially if you're overweight, have a family history, or are over 40, as early diagnosis can prevent complications down the line. And now, how doctors diagnose diabetes. Doctors use simple blood tests to diagnose diabetes. The most common ones are 1. Fasting blood sugar test. For this test, you don't eat or drink anything except water for at least 8 hours before the test. As food can greatly affect blood sugar, this test allows your provider to see your baseline blood sugar. You considered normal if the result is under 100 milligrams or pre-diabetic. Stage if the result is between 100 to 125 milligrams DC. Diabetes is considered when the test is 126 milligrams DC or higher. 2. Random blood glucose test. Random means that you can get this test at any time, regardless of if you fasted. Normal, below 140 milligrams DL. Pre-diabetes, 140 to 199 milligrams DL. Diabetes, 200 milligrams DL or higher. 3. HbA1c test. It's the most important one because it shows the average blood sugar over the past 2-3 months. Also, it is the one that used for the follow-up of the disease. The idea of the test is that the glucose in your blood sticks to hemoglobin, a protein in your red blood cells. As your blood glucose levels increase, more of your hemoglobin will be coated with glucose. An A1C test measures the percentage of your red blood cells that have glucose-coated hemoglobin. An A1C test can show your average glucose level for the past 3 months because 1. Glucose sticks to hemoglobin for as long as the red blood cells are alive. 2. Red blood cells live about 3 months. According to the test, you will be considered normal if the result, under 5.7%, or prediabetes, if the result, 5.7% to 6.4%, and diabetes begins from 6.5% or higher. 4. Oral glucose tolerance test, OGTT, used mainly for pregnant women. Blood sugar is checked before and after drinking a sugary drink. These tests help doctors figure out what kind of diabetes you have and how severe it is. Okay, so now, dear, do you know what is the worst thing about diabetes? Yes, you are right. It's complications. If diabetes left untreated, diabetes can lead to serious complications. We will divide them into 2 groups. First group is the acute diabetes complications. Acute diabetes complications are the group that can be life-threatening, and this include 1. Diabetes-related ketoacidosis, DKA. This complication mainly affects people with type 1 diabetes, especially children or undiagnosed T1D, so it can be the first presentation of the disease. It happens when your body doesn't have enough insulin. If your body doesn't have insulin, it can't use glucose for energy, so it breaks down fat instead. This process eventually releases substances called ketones, which turn your blood acidic. This causes labored breathing, vomiting, and loss of consciousness. So now, what causes DKA? For some people, especially children, becoming suddenly very ill with DKA, what leads them to finding out they have type 1 diabetes in the first place. If you have already been diagnosed with diabetes, the causes of DKA can include: first, being ill, for example with a chest infection, flu, or urinary tract infection, UTI. 2. High blood sugar levels caused by a growth spurt or puberty. 3. Not taking your insulin or missing doses. 4. Your insulin pump not working properly or becoming accidentally dislodged. 5. Surgery or an injury, because any stress the patient encounter leads to increased release of cortisol, which leads to increased glucose. 6. Having a heart attack or stroke. 7. High blood sugar caused by having your period. Sometimes there isn't always an obvious trigger for DKA, which can be worrying and confusing. But if you suspect you or your child has DKA, it is important to get medical help straight away. Being an extreme emergency, we need to know what are the signs and symptoms of DKA. The features of ketoacidosis are those of uncontrolled diabetes with acidosis and include prostration, hyperventilation, which called small respiration, nausea, vomiting, and occasionally abdominal pain. The latter is sometimes so severe that it can be confused with a surgical acute abdomen. Some patients are mentally alert at presentation, but confusion and stupor are present in more severe cases. Up to 5% present in coma. Evidence of marked dehydration is present as thirst, dark yellow, strong-smelling urine, infrequent urination, dizziness, tiredness, and dry mouth, lips, and tongue. Other signs can include sunken eyes, headache, and in severe cases, confusion and rapid heartbeat. The smell of ketones on the breath allows an instant diagnosis to be made by those able to detect the odor. The skin is dry and the body temperature is often subnormal, even in the presence of infection. DKA is diagnosed in hospital with a blood test results that can indicate DKA. They are: high blood sugar levels, can only be confirmed by a finger prick check or a continuous glucose monitor. High levels of ketones, a chemical in your blood and urine, which can only be confirmed by a handheld ketone monitor or urine ketone test. Increased blood acidity due to high levels of ketones. Management of DKA requires immediate medical treatment, which includes replacing the fluid losses, replacing the electrolyte losses, restoring the acid-base balance, replacing the deficient insulin, and monitoring blood glucose closely. So now, if you have type 1 diabetes, what can you do to avoid DKA? Indeed, you can help avoid DKA by monitoring your blood sugar levels regularly and altering your insulin dose in response to your blood sugar levels and what you eat. Your blood sugar levels could be higher than normal when you are unwell, putting you at risk of DKA. So it's a good idea to work with your healthcare team to come up with some sick day rules for when you are ill. These usually include drinking more sugar-free fluids, taking more insulin, and checking your blood sugars more often than you usually would. The amount of extra insulin needed will vary from person to person. Your diabetes team will help you to work out the correct dose for you or your child. It's still a good idea to contact your GP or diabetes team if you feel fine but are getting higher than usual readings for blood glucose and ketones, or you feel unwell but your blood glucose and ketones are only slightly higher than normal, and for sure if you are being sick a lot. Now let's talk about the second acute complication, which is hyperosmolar hyperglycemic state, HHS. This complication mainly affects people with type 2 diabetes. It happens when your blood sugar levels are very high, over 600 milligrams per deciliter, for a long period, leading to severe dehydration and confusion. It requires immediate medical treatment. Diabetes-related ketoacidosis and hyperosmolar hyperglycemic state, HHS, are both life-threatening diabetes complications related to high blood sugar, hyperglycemia, but they're different conditions. DKA happens when your body doesn't have enough insulin, because the cells that are responsible for that have been destroyed by the immune system of the patient himself. And your body needs insulin to turn glucose, your body's go-to source of fuel, into energy. If there's no insulin or not enough insulin, your body starts breaking down fat for energy instead. Your body breaks down fat, it releases ketones into your bloodstream. Ketones cause your blood to become acidic, which is life-threatening. HHS happens when very high blood sugar leads to severe dehydration and highly concentrated blood, high osmolality, which are life-threatening. HHS also involves a lack of insulin, but the person usually still produces enough insulin to prevent the production of ketones. In addition, there's usually an underlying condition, such as an infection, that's also contributing to the high blood sugar. The main difference between DKA and HHS is that DKA involves ketones and blood acidity. HHS doesn't. The two complications have similar symptoms, including increased urination and thirst, dry mouth and skin, confusion, and drowsiness, progressing to loss of consciousness. Other symptoms may include weakness, nausea, weight loss, fever, and in severe cases, seizures and coma. First, infections. Infections are responsible for 50% to 60% of HHS cases. Actually, pneumonia, urinary tract infections, and sepsis are the three most commonly involved infections. 2. Stopping diabetes medications. If you stop taking your medications to manage diabetes, it'll result in high blood sugar, which can lead to HHS. About 21% of HHS cases involve this situation. 3. Certain medications, such as corticosteroids, can affect carbohydrate metabolism, triggering the development of HHS. 2. Heart and blood vessel issues. Sudden and severe cardiovascular conditions, such as stroke, pulmonary embolism, or heart attack, can trigger your body to release stress hormones, triggering the beginning of HHS. When you have high blood sugar, your kidneys try to get rid of the excess sugar through your pee. Through this process, you also lose fluids that your body needs. If your blood sugar remains elevated for a long period of time, it leads to dehydration through frequent peeing. It also causes your blood to become more concentrated than normal. This is called hyperosmolarity. Okay, so now, what are the risk factors for hyperosmolar hyperglycemic state? HHS mainly affects people with type 2 diabetes, typically adults older than 65 years. If diabetes is well managed, your risk of HHS is low. The following factors can increase your risk of developing HHS: having poorly managed diabetes, or being 65 or older, or having other health issues, such as an infection, illness, or a heart condition. Okay, now you should know what are the complications of HHS to be aware. If HHS isn't treated in time, it can lead to the following complications: seizures, coma, organ failure, or, unfortunately, death. Now, how is hyperosmolar hyperglycemic state diagnosed? You should seek medical attention right away if you have symptoms of HHS. At the hospital, a healthcare provider will perform a physical exam and ask about your symptoms. They'll order blood tests, such as a comprehensive metabolic panel, to check your blood sugar level and other measurements of your health. A blood sugar level over 600 milligrams per deciliter with low ketone levels points to a diagnosis of HHS. Now you might ask, how is hyperosmolar hyperglycemic state treated? To treat HHS, a healthcare provider will give you intravenous medications. These include fluids to hydrate you, electrolytes such as potassium to balance the minerals in your body, and insulin to regulate your blood sugar levels. Your healthcare team will also treat any underlying conditions or infections that may have caused the HHS. You'll likely have to stay in the hospital at least overnight, so your healthcare team can watch you closely for any complications. And that brings us to the end of this part of our journey into understanding diabetes. We've explored what it is, how it affects the body, and why it's so important to catch it early. But this is just the beginning. In the next video, we'll discuss the last one of acute complications, which is hypoglycemia. Then, understanding the chronic complications of diabetes. Next, we will dive deeper into how to manage diabetes effectively, from diet and exercise to medications and lifestyle tips that really make a difference. So if you or someone you care about dealing with diabetes, you won't want to miss it. Make sure to subscribe, hit the notification bell, and stay tuned, because the next episode could change your life. Thanks for watching, and see you in the next one.